Welcome to the Manitoba Fitness Council Aquatic Fitness Certification course, Chapter 15. In Manitoba, the MFC requires participants to sign a PARQ Plus and be apparently healthy to participate. This chapter is to provide some information about common populations and their cautions or modifications which should be given during the class. These populations may require further medical clearance from their doctor. Additional information is available on page 255 of your textbook. During this chapter, we're going to talk about teaching special populations, special considerations when teaching seniors, cautions for arthritis, cautions for pre- and postnatal clients, and the difference between aquatic fitness and aquatic therapy. Some special populations will be in every one of our classes. It's important for us to understand that medical clearance is done with each one of our participants. Participants turn to aquatic fitness because other forms of exercise are not working and possibly cause pain. It is important to seek medical clearance and ask about any contraindications that they may have, as expressed by their healthcare provider. On page 274 of your textbook, there is a list of conditions for you to review. We need to understand why they came to your class. We need to understand and review general safety guidelines. This information is reflected on page 275 of your textbook. A list of possible conditions that could be present in an aquatic fitness class include cardiac rehab, post-surgery, hip and knee replacements, multiple sclerosis, stroke, post-polio, deafness, asthma, depression, osteoporosis, back pain, arthritis, fibromyalgia, motor vehicle accidents, diabetes, mastectomy, blindness, obesity, Parkinson's, sports injuries, and rehabilitation. What we have to be careful of is that these people are qualified as apparently healthy individuals and have been cleared by either the PARQ Plus form or their medical doctor to be able to participate in our classes. One of the things that we have to think about also the reasons that people will come to our class. So even though these people have some potential considerations that we have to be aware of, they're all looking for improved wellness. Many of them are looking to work on falls prevention. Many of them, it's a safe place for them to come out and exercise. Most of them need guidance on exercise. It gives us a great opportunity to get them in the pool, get them moving, get them using their joints in every different range of motion that they can, while in an environment that provides them stability, support, and as much of a pain-free environment as possible. We can help them to improve their quality of life. Some people come to prehab, so their medical doctor has cleared them for exercise. They can come to our classes. So these could be people who are looking for or waiting for a knee replacement or a hip replacement. They need to keep the muscles strong around that joint. And unfortunately, aquatic fitness is one of the only places that they can go where they can get the full range of motion and work on those muscles in a safe environment. Now, especially with these people, you have to be very careful. Are they people that can go in the deep water? Can they use a flotation belt? And can they be in the back where they have no impact that's going to cause them extra pain and discomfort? We want to make sure that we support and provide education to these people. If pain is an issue for them, we need to work with them to go back to their doctors or go to their healthcare providers and see if there's a way that they can work through pain management with regards to exercise. On page 256 of your textbook, there are some older adult challenges that are listed. The first one that's listed is limited range of motion. So the old wives' tale that talked about if you don't use it, you lose it is absolutely true. So the challenge is that if they have not lifted their arms over their head or arms all the way out to their sides or even reached down toward the toes in years, that may not be something that's available to them and they may have to work to get it back. They may also have hypertension. So again, having them work with their doctor to make sure that they are cleared for exercise and that their hypertension is managed so that they can get in the pool. The hydrostatic pressure does actually help with the hypertension once they get in the pool. Coronary and vascular disease. So these are people who have been cleared for exercise. They may have these considerations, may have these conditions, but they may still be cleared for exercise. And sometimes, unfortunately, with the PAR-Q Plus form, we may not even know this. So if they've been cleared and their directive comes back to the fitness instructor that says, Shirley has been cleared for low to moderate physical activity, then we are going to have to work with Shirley at low to moderate physical activity level to get her to a point where she can get into that moderate level a little bit more. But this may be her issue, but she also may be cleared for exercise. She has to be cleared for exercise to be in our class. Some people have nutritional deficiencies. So when we talk about Canada's food guide, for instance, there is lots of research that's been done. The brand new food guide is out, and it's about looking at deficiencies that are in our diet. So a lot of people are getting enough protein. They're not necessarily getting the nutrients from the vegetables, or they're not getting enough fruits and vegetables in their diet to be able to provide all the things that they need in order to work well. Diabetes is something that's a lot more commonplace, and again, sometimes diabetes brings with it extra weight and levels of obesity. So this may be a great place for people to exercise. Getting them in the pool where they don't have, again, so much stress on their joints may be a comfortable place for them to exercise. Bone and joint issues, arthritis, hip replacements, osteoporosis. So again, the cooling effects of the water, the hydrostatic pressure, the release in the amount of impact on those joints is going to provide an environment that these people can get out and get some exercise in a way that feels safe and effective and comfortable for them. Anyone with a sensory impairment, so whether they are deaf or blind, the water can be a great place for them to get in and exercise, as long as it's done in a safe way and you have someone who is with them so that they can provide these extra sensory support that they need. Medication. We may have people who come who are on nitro, for instance. We may have people who are diabetic and need to have sugars available to them in their diet, or close to the pool sort of thing. So we have to make sure we are not ones that are giving medication, but just understanding sometimes the effects of medication and talking to people about if they have a nitro spray that they need to have access to, that we know exactly where it is. Depression is something that happens not just with older adults, but it can happen with anyone. But it is, again, a great way to give extra social opportunities for participants when they get in the pool. Can help offset some of the effects of loneliness. I have this one lady in my class, and she's the sweetest lady. She has lived alone, it sounds like, for at least 15 to 20 years. She gets in the pool and she works hard, but she talks a lot. I know that one of the big reasons that she comes to class is because she is looking for social connections. So again, I have to understand, or we have to understand, why it is that people are coming to our classes and allow them opportunities for that. We also make them or give them the opportunities to work hard so that they have that intensity option. But again, trying to understand that older adults can be even sometimes more lonely and more depressed than other people. And sometimes it's not easy to see until you see the way that they connect with other people in the class and how much they seem to really need that communication while they're there. Other older adult recommendations for aquatic fitness: we want to make sure that we give them a longer warm-up. So give them more time to get the synovial fluid moving, give them more time to do range of motion activities. You want to provide more modifications, and the reason for that is because you will have more people with different issues, and so you want to make sure that you have options for all of them so they can all feel like they're working hard or working to the best of their abilities. You want to make sure that you reduce repetition. You want to make sure that you give them different things to do. So they're not wanting to come necessarily and do the exact same class every single time. You want to make sure that you, and the other thing is, when you have them moving in one way for a long period of time, that can make them sore. So you want to make sure that you are changing it up, having the legs move front and back, having the legs move side to side, and moving through those different ranges of motion on a regular basis. Using interval training is a great way to get their heart rate up in a safe environment. Also, it's short term. So interval training, usually 20 seconds, 30 seconds sort of thing. They have an elevated heart rate. They're still getting the cardio that they require, but they are getting it done in a shorter amount of time. Cue falls prevention. One of the things that's great about in the pool is it gives people the opportunity to work on falls prevention. This is kind of a newer area that the MFC is focusing a lot of attention on. But what we're doing is, for instance, when you have people walking back and forth in a pool, you can have them look over top of one shoulder as they walk across the pool. So they're walking across the pool forward, looking over top of the left shoulder. On the way back, they're going to look over top of the right shoulder. So again, those are some opportunities for you to work on some falls prevention, but you have to cue them. They're not naturally going to walk across the pool with their head looking right over top of the right shoulder unless someone gives them that idea or cues that for them. You want to make sure there's a work balance so that you are not bringing them in, working them really hard for 40 minutes or 50 minutes, and then having them do almost nothing for the last 10 minutes. So with older adults, you want to go back and forth between the cardio and the muscle conditioning a little bit more. So for instance, you can take it down so that you're doing a ski for 30 seconds, a neutral ski for 30 seconds, a rebound ski for 30 seconds, but maybe then you're going to move it to a rocking horse. And a rocking horse is much harder to use in an interval training setting because it's hard to get the heart rate up as high in a rocking horse. So you want to kind of move back and forth to make sure that you are balancing out the workload in those particular classes. Lateral changes of direction can be challenging. So again, getting back to hips and knees, when you have people moving laterally for long periods of time, or even 1 minute in a lateral movement, moving side to side, can create some extra pull and extra tension on the knees and hips, and can create some extra discomfort for older adults. Reaction games are fun. So you can do things like you can have people, kind of jogging across the pool or walking across the pool. You can have them, you can yell out commands: left, right, step over, step up, these kinds of things to give them opportunities. Again, this is one of those focus points of falls prevention. So it's a great way to practice in the pool and gives them the opportunity to, even if they stumble a little bit, they can catch themselves with the water before they fall right down. Multitasking. Maybe you have them do a partner drill where they have to have a conversation about something. So maybe they are skiing, and as they're skiing, they are touching hands with the person that's their partner. So as one's right hand goes up, the other's left hand goes up. So they are trying to time themselves so that they're doing an activity, maybe with a partner, maybe by themselves. Maybe they're multitasking and doing a in, out, kind of a jog. And then maybe you have them, with aqua bells on top of the water, moving in it in a different direction. I mean, there's lots of different options for that. There's 3 different types of arthritis that we look at when we are teaching older adults in the pool. The 3 types that we have already covered actually in exercise theory are osteoarthritis, rheumatoid arthritis, and fibromyalgia. If you are working with any of these groups, you are going to need some extra workshop time and some extra certifications. The Manitoba Fitness Council does offer workshops that help people provide understanding of these 3 conditions and help you to understand what it is that people need, how long they should be sore or will they be sore after class, and what are the exercises that you want to avoid if these are some of the activities or some of the conditions that people have. Some of the arthritis aqua fitness recommendations include working towards optimal range of motion for all joints. Avoid overstretching. So like a normal class where you would have people stretch to their full range of motion, in an arthritis class, you would not. You would want to use slower, more mindful movements. You would want to choose lower impact movements. You would want to choose exercises that improve muscle strength and endurance. You want to choose things that improve core and joint stability. You want to strongly encourage people to wear proper footwear. Progress slowly. Even people who are young and have arthritis, and you may not really be able to tell by looking at them, progressing slowly is really important. So for instance, even something as simple as hanging onto an aquatic fitness dumbbell while you have them sliding it across the water may provide extra pain for them kind of going forward the next day. So you want to be very mindful of that. You want to be sure to include breathing and relaxation awareness. Social interaction, there it is again. You want to build in activities that reduce fear and build confidence. Find things that they can do. Find things that they're going to be successful at, and those are the things that you should be teaching them in your class. For more information, you can look on page 263 and 264 in your textbook. Other arthritis considerations to be aware of. Number 1, water temperature. So cooler water can cause muscle cramps, muscle tension, and increased pain. In Winnipeg, we have 3 to 4 warm water pools or warmer water pools. They are Bernie Wolf Pool, Margaret Grant Pool, and the Wellness Institute Pool. Water depth is also can be a consideration. For those with arthritis in the low back, hip, or knees, they are going to do better in shoulder depth or transitional depth water. Those with arthritis in the upper body or neck may do better at chest height water. Even if people are in the shallow water, like the people in this picture, the water belt may also help decrease impact. So you can imagine that if these ladies and gentlemen wore an Aqua Fitness belt, but wore it around the waist as opposed to wearing it around the hips, you can see how that might decrease their level of impact on the bottom of the pool. When we're looking at music for this group, you want to choose music that has a beat, but maybe not a real strong beat. You want to encourage clients to move at their own pace instead. Equipment for this group is usually not appropriate. Lots of times it's used incorrectly. Gripping can be a real issue for this group to be able to hold on to any pieces of equipment. And so sometimes it can cause more joint pain than help. There are opportunities or times when a noodle may be very beneficial to help hold someone up or hold someone into a position. So then it's not being used as resistance, it's being used for a flotation piece, and that's a little bit different. Socializing with this group. Acknowledging that those that are in pain may suffer short term. Try to increase the level of laughter. Try not to let the class become about pain. Try to let it become about something positive and how people feel great about moving in the water. You just want to be very careful that it doesn't become a situation where a lot of people are coming to the class just to complain. You want to use a longer warm-up. Allow it to increase body and joint temperature, so even longer than a normal older adult class. There's a full lesson plan in your book on page 266 if you'd like to have a look. As with the older adult certification, there's also a pre- and postnatal certification. So pregnancy is also another term in people's lives when we should get some extra training in order to be able to work with them. The active older adult certification helps us to be able to work with active older adults. The Manitoba Fitness Council pre- and postnatal fitness leader certification or designation can help you understand the changes that happen to a body or anyone's body when they are pregnant. One of the things that we have to look at is the PAR-MED-X for pregnancy. This is outlined on page 269 of your textbook. It is a three-way communication tool between the client, healthcare provider, and Aqua Fitness instructor. It contains safety information which enables the pregnant woman to make healthy exercise choices. It is also a medical clearance form to continue with the program. There are lots of questions that we would potentially ask someone who is expecting. The challenge is that what would we do with the information? We have to be very careful about what questions we ask, what questions we don't ask. Therefore, we just let the PAR-MED-X for pregnancy essentially ask all those questions. There's also some follow-up questions. If they answer yes to one of the questions, it's going to give them extra questions that are going to help follow up on their condition or potential conditions or even previous conditions. So the benefits of aquatic fitness for people who are prenatal. Mom and fetus will not overheat like in a land-based class. The hydrostatic pressure assists in venous return, which can be challenging for pregnant women in land classes. Edema reduction. So anyone who has lower leg swelling, the hydrostatic pressure helps reduce the swelling in lower extremities. Buoyancy provides support and aids in balance. The risk of falls is decreased. Water is supportive when a pregnant woman's center of mass is changed. It reduces joint pain, specifically low back and pelvis. The challenges for pre- and postnatal exercises in the water: body temperature. Sometimes they have a lot of fatigue and nausea, so this can be challenging. You want to make sure that they are not getting in the pool if they are feeling nauseated. They may end up with relaxed joints. They may have pelvic floor weakness. They may have breast sensitivity, fluid retention, or maybe even acid reflux. Some other postnatal challenges are reflected in your textbook on page 273. You have to make sure that if someone is returning to your class after they have had a baby, that the participant needs to be at least 6 weeks after a delivery. Usually, this is something that, or they should be, seen by a doctor prior to them coming back to a class, especially if they've had a natural birth. They should have medical clearance from their doctor from the beginning. It may even be up to 6, 8, 10 weeks, depending on any kind of complications that the woman's body went through. They may have things that we need to look out for after, which is why we want to have some extra training in order to be able to work with these ladies. It may include pelvic floor weakness, abdominal separation, joint laxity, fatigue. Then there's some repercussions if they're breastfeeding. What does that mean if you were in a postnatal fitness class? What we've been talking about for the last 15 chapters is about aquatic fitness and not about, for the most part, aquatic therapy. In aquatic fitness, we use light bounce and rebound exercise. We challenge the cardiovascular system and we develop muscle strength and endurance. So what is the difference between that and aquatherapy? Aquatherapy, for the most part, focuses on rehabilitation. There's a greater focus on posture and core stabilization. They do work to improve range of motion and normally uses warm pools, 86 to 90 degrees Fahrenheit, or in Celsius, that is approximately 29 to 32 degrees. That sounds really warm, but it's actually shockingly not that warm. So those are the differences between aquatic fitness and aquatic therapy.